Hi, I'm Dr. Farber.
Hi, I'm Dr. Shah.
So let's talk about your consultation. So how do patients find us? Typically, patients find us through a Google search, through our website, even through YouTube, through family and friends, through their physicians, and sometimes even through social media. So how do you set up a consultation? Well, first step is to reach out. You can reach out via our website. You can email us, contact us on social media, or even call us or text us. So that's the way you can reach out to us to see if setting up a consultation is right for you.
So once you decide to give us a call, then you can insert your inquiry through our website. You can give us a call. There's so many different ways. But if you go on our website, then it will actually ask you, what way do you like to be contacted? So we can talk to you via email. We can do it via text. We can also do it over the phone. And so you'll get some communication with us over the, maybe within 24 hours or so. And then once you set up the consultation with us, then a lot of things happen. There is a scheduling fee, but that's to cover a lot of the administrative things that we do before your surgery. So once you schedule a consultation with us and just give us a little bit of background information about what you're interested in, we'll actually give you links to a lot of information. Also, if you want to talk about concerns that you have that you want to bring up, if you want to send us some information about prior mammograms or prior surgeries you've had, implants that you've had, or you just want to send us your medical notes, then we can look at it and be prepared for your consultation. The other thing is, if you have questions about financing, about approximate prices, we won't be able to give you a real quote until we actually examine you and determine what exactly is going to help you achieve your goals. But if you have any questions about that, you can also talk to us. Our goal is that when you come into the consultation, then what we are talking about is specifically you, and you have all the information to make the best decision for you, and then we can actually work together to get to to achieving your goals.
Now, prior to showing up for your consultation, you will get a link to access the patient portal where you can enter your information, which will help expedite your consultation day. So you can enter your information on your medical history, your allergies, your medications, that sort of thing. And there's communication that can be done through the patient portal or other methods as well. So on the day that you show up for your consultation, you'll be in a nice, calm, and quiet room. You'll meet with either Dr. Shah or myself. And we'll go over, all of your specific concerns and why you're here for your consultation. So we will listen to you and spend a lot of time with you in order to get all your concerns heard. And that way we can give you the best option or options, because sometimes there's more than one option to address your concerns. So there's different ways to do surgeries, and we would typically give you all the options and help you decide which one is best for you. There are also things that we do along with just discussing. Where you'll be examined. We may even take measurements. We may even take photographs. We can show you different things on our iPad in terms of images and videos in order to help guide your decision. So that all happens during the consultation. And oftentimes people leave the consultation with questions as well. So they'll walk out the door and they go, oh man, I wish I would have thought about this. But we're always available. You can call or email us anytime to get those questions answered to help you make your decision.
Yeah, if you're wondering how long should you set aside for your consultation, so usually people come between 15 to 30 minutes before their appointment so they can fill out all the paperwork. If you fill it out online, then you don't have to come in as early. And then the actual consultation with the doctor itself will take about 30 minutes. And then going through the finances, all the details, and all the other stuff is about another 30 minutes. So give yourself an hour to an hour and a half. Just set aside that time for the whole process, even if it just says that your consultation is 30 minutes. All of your consultation, follow-up, everything is with either myself or Dr. Farber. We don't have a salesperson that's trying to sell you surgery or anything. We only will recommend the things that actually you need, and also if it's not a good idea to do it, or if what you're wanting isn't going to be achieved by the surgery or by us, then we'll let you know that too. That's a really important part about the consultation. I think that it's a disservice when the consultation is not done by the actual surgeon, because we're the ones, we know what we can do. And when somebody who isn't a surgeon or somebody who isn't the surgeon is doing your consultation, then how do you know that you're actually going to get the results that you're hoping to get?
Right. So after you meet with us, like Dr. Shah was alluding to, you're going to meet with our practice manager, and she'll go over financing options, and then scheduling with you. And if you do decide do you want to schedule, you can actually schedule the same day if you want to, or any day after that. But once you do schedule, we'll bring you back here for a preoperative appointment. Usually it's a couple weeks prior to your surgery, where we'll go over everything in detail again, answer any more questions that you may have. If you are getting breast implants, we would size you for your breast implants at that point, and kind of demonstrate again, the results that you can expect. And we'll take preoperative photos of you, measure you for your garments, get your prescription. So there's a lot of things that happen in that time from your consultation and your preoperative appointment. And typically we also, if you do schedule, we want to get clearances if you have any medical history that need to be cleared. And then you'll get some lab work prior to your surgery as well.
Yeah, so there's a lot that happens. So as soon as you put in your inquiry and schedule a consultation with us, then it's a lot of communication with us and our staff. And as soon as you book surgery, it's not that you just wait until your pre-op appointment. There's a lot of work that goes in between, because we want to make sure that this is the right surgery for you, you get the results that you want, and also that we're doing this in the safest way possible.
Right. I think one of the most important things that differentiates us between other practices is that you get to see us, the surgeon, every step of the way, from your initial consultation to your preoperative and your postoperative. Every visit you see us and only us, and I think that makes a huge difference in your care and your results.
Yeah, and I think that because we did the surgery, if we did the surgery, so we know what happened during the surgery, we know exactly what was done, and we also know when something is starting to go in a direction that it's not supposed to, or if everything is okay. If you I have a concern about this, then we can tell you, no, that's normal, because we actually know the entire post-operative period. We don't pass you off to a nurse or to somebody else.
Right. And obviously, if you're watching this video, you found our YouTube channel, but prior to your visit or your consultation, even your pre-op visit, there's plenty of videos on our YouTube channel that explain the different kinds of surgeries that we do. So feel free to check them out and learn a lot.